Morning everyone. So today let's discuss about what we have discussed yesterday. We have discussed about prescription and parts of prescription, and today we will discuss about handling of prescription. How to handle a prescription means the patient will take the prescription from the doctor and he will get the prescription towards you, that is pharmacist. He will bring the prescription towards the pharmacist. Now the pharmacist, how he will respond towards that prescription, how he will respond towards that prescription is called as handling of the prescription. So how he will handle the prescription, now we will see in this class. So the first thing you see regarding handling, the first one is receiving the prescription. So how you have to receive the prescription? When patient has given prescription to you, then you have to take the prescription. You should not change your facial expressions. You should not change your facial expressions. Why? If you change your facial expressions, the patient may think, he will get confused, or the patient may think that he got some extraordinary disease, it cannot be cured. Like that, he may think if your facial expressions are not good, and if your facial expressions are confused, then he may get confusion that the doctor has written something wrong. So that is why your facial expression should not be changed when you receive the prescription. Your facial expression should be stable and constant. So that is what is the first one, receiving the prescription. Second one, reading and checking the prescription. Now the second thing what you have to do, you have to take the pharmacist has to take the prescription. He has to read the prescription carefully. He has to check the prescription carefully. Why? You know, the doctor's format of writing is somewhat different. So that is why the pharmacist has to check the prescription once or twice so that he may dispense the perfect medicine to the patient. If he gets any doubt while checking the prescription, he has to consult the doctor. He has to move towards the doctor and he has to ask the doctor whether to prescribe this medicine or not. So that is what is reading and checking. And the third one is collecting and weighing the material. So the pharmacist, what he has to do after he has read and after he has checked the prescription, now he has to collect the material from the shelves. In the medical shop, you know, different shelves are available. Now he has to go to the shelf and he has to collect the material. So he has to collect the material and he has to give according to the dose, according to the weight the doctor has given. He has to give according to that weight and according to the dose. He has to collect the material and he has to weigh it and he has to produce or he has to dispense it to the patient. So that is what is collecting and weighing the material. The next one, the last one is compounding, labeling and packaging. So after weighing the material, then what he has to do? The pharmacist has to compound the material. Means he has to prepare, if any preparation is there. For example, if any syrup is there, he has to prepare the syrup. This is mainly for the olden days. In olden days, what the doctors have to provide the material and he will write the material. He will write the material in the prescription. The pharmacist, what he will do? He will prepare the preparation and he will dispense it to the patient. But nowadays it is not possible. It is already totally ready-made. So now what the pharmacist has to do? Now the pharmacist has to compound the medicine, means he has to prepare the preparation which is prescribed by the doctor, and after compounding he has to put that preparation in one container, suitable container. So in one suitable container he has to fill that preparation, and after filling that preparation into the suitable container, then he has to label it. Means by taking a white paper, by taking a plain white paper, he has to attach the white paper and he has to label it. This is so and so medicine. This contains these ingredients. This has to be taken like this. Like this, he has to label it with a plain white paper. He has to write everything on it and he has to attach it to the container. So that is what is labeling. And the next one is packaging. So after labeling it, then he has to pack that whatever the bottles or whatever the containers are there, he has to pack it and he has to give it to the patient. So that is what is handling of prescription. Simply, the handling of prescription mainly involves receiving the prescription, reading and checking the prescription, and the third one is collecting and weighing the material, and the last one is compounding, labeling and packaging the material. So this is about handling of prescription. And the next thing is sources of errors in prescription. So whenever the pharmacist has taken the prescription and he has checked it, there may occur some errors. So what are the sources of errors of prescription? Now we will see in this class. So what are those sources of errors? The first one is abbreviation error. Abbreviation error means the doctor will write abbreviations for the medicine. He will write some abbreviations for the medicine. When pharmacists think one abbreviation in the place of another abbreviation, then it may go wrong and he may dispense another medication in the place of original medication. So that is one of the error that will occur. So that is one type of error. Next one is name of the drug. So name of the drug. See, in pharmaceutical terms, there are different names which pronounces with the same sound. There are different names of the drugs, different names of the medicines which are pronounced with the same sound and same spelling sometimes. So for example, you see digitoxin and digoxin. Digitoxin and digoxin are there. If the doctor prescribes digoxin and if the pharmacist thinks that it is digitoxin, then he may give the wrong medicine to the patient. So this is also one type of error, that is name of the drug error. And the next one is strength of preparation. So the strength of preparation is very much essential. How much amount of the dosage form he is giving? What is the strength of the dosage form the doctor is giving? For example, the pediatric patients are there, children, their strength will be less. The strength of dosage form will be less. When you consult adults, the adults dosage form strength will be more. So like this, the strength should be clear. The pharmacist should check the strength of the preparation clearly. If it is not mentioned clearly, then he has to ask the doctor regarding the strength of preparation. The next one is dosage form. Sometimes dosage form error may occur. For example, if you think paracetamol, the paracetamol is available as syrup, paracetamol is available as tablets. So like this, if the doctor prescribes only that is paracetamol, then if the pharmacist has to ask the doctor regarding that whether it has to be given as tablets or whether it has to be given as syrups. So mostly for children we will give as syrups, for adults we will give tablets. So like that there should be clarity. So that is what is dosage form clarity. So each drug, each medicine will be available in different dosage forms. It may be available as syrup, it may be available as tablet, it may be available as capsule, or it may be available as parenteral also. So that is why the pharmacist should take clarity from the doctor in which dosage form we have to give. If it is not mentioned clearly in the prescription, the pharmacist has to ask the doctor regarding the dosage form in a clear way, so that he has to dispense a perfect medicine to the patient. And the next one is dose. Dose is also very much essential. Dose. So what is dose? How many times the patient has to take the medication? Sometimes the tablets can be taken in the morning and in the evening, or morning, afternoon and evening. If the doctor doesn't mention it in the prescription, if the pharmacist doesn't see it and if he dispenses to the patient, he don't know, he will take once or he will take twice or he will take thrice. So there may be problem while taking like that. So that is why the dose should be mentioned clearly. This is also one type of error, dose error. The next one is instructions for the patient. So instructions for the patient is very much essential. The pharmacist or the doctor or pharmacist, mainly it is the duty of the pharmacist to tell the patient regarding the instructions, means how many times he has to take the tablet, what is the route of administration, in which route he has to take the dosage form, in which way he has to take the dosage form, after eating or before eating. Like that, every instruction should be clearly given to the patient while dispensing the dosage form or while dispensing the medicines which are given in the prescription. Next one, incompatibilities. So this is one of the important type of error, incompatibilities. Sometimes the doctors they will write the prescription without any intention. They will write directly the prescription. Then the pharmacist should check, is there any incompatibility? Means some drugs, for example, if you take two drugs at one time, one drug will react with other drug and it may cause problem in the body. So that is why the pharmacist should check if any incompatibility is there between the drugs. Another incompatibility is also there, that is food drug incompatibility. For example, you see here, certain antibiotics should not be given with meals. So after eating, if you take certain antibiotics, those antibiotics does not function properly, or those antibiotics may become toxic if you take meals along with that antibiotic. So such type of incompatibilities, if any such type of incompatibilities exist, the pharmacist should inform to the doctor, and he has to change the medication, or he has to tell to the patient regarding the right way of administering the medication. So these are the sources of errors in prescription. While taking the prescription or while providing the prescription to the patient, the pharmacist has to check these type of errors. If any this type of error is present, then it may cause some problems in the patient. So these are the sources of errors in prescription. So thank you. Jai Hind. Subscribe to my channel for more and more pharmacy classes and informative videos.